The tools are there, and it is easy to address the causes of trachoma. If only people could constantly wash their faces, this would be addressed. And if only they could maintain a clean backyard and environmental sanitation, this could be addressed. But the reverse seems to be the case, and trachoma is far more prevalent than is visible. The impact is so devastating, prompting serious economic and social problems in rural Ethiopia. People are going blind by a cause that could easily be addressed. Today, 138,000 Ethiopians have become blind as a result of trachoma, and 1.3 million are suffering from trichiasis. Unless they undergo trichiasis surgery, they are bound to easily become blind. All the same, it is much more difficult for all these to earn a living. In the Amhara region of Ethiopia, a significant number of people suffer from trachoma, which quite easily ends in blindness. And in addition to the prevention efforts of the government, the role played by international non-governmental organizations is considerable. CBM has joined the Organization for Rehabilitation and Development in Amhara, ORDA, a local NGO, in trachoma prevention and treatment of patients in South and North Wallo zones of the region. Trachoma is caused by Chlamydia trachomitis, a bacteria that affects the eye. It is easily transmitted from one person to another. Lack of environmental sanitation and personal hygiene issues are to blame. Children under 5 in particular are more exposed to the disease. And in most countries, women, because of their proximity to children, are 3 times more likely to contract trachoma than men. The urgency is there, including in Ethiopia.
It's been a year since we started this intervention, and we've carried out a number of trichiasis surgeries. We have also undertaken trachoma prevention activities. We have referred cases that are beyond our capacity to other health facilities. Over 100 people have received treatment so far. We were able to see that they were in a better shape when we visited them in their homes.
The procedures are undertaken in villages where the patients live. Without this, they would be forced to travel to distant locations seeking those services and in the process incurring expenses that are beyond their means.
Each one of these patients would have ended up spending at least $200. The fact that this treatment is provided free of charge has helped them from spending beyond their means. It has also allowed them to get treatment in their villages. There is so much optimism.
And the intervention has even gone a step further. In consultation with the health extension workers, the project is reaching out to people who otherwise would have not gotten the chance.
There are a lot more patients other than the ones whom we have treated. We look for and visit them in their homes and bring them over for treatment. But all that aside, we are undertaking prevention activities. We encourage them to immediately come over when they detect signs of trachoma and coach them how to maintain environmental sanitation and wash their faces. It's been a while since I got sick. It gets better. I decide it is gone. But then the pain comes back again. When I look out into the distance, my sight becomes foggier. I wipe it this way and I can see better, and so on. Now that I am operated on, what can I say? When healed, all I can say is, bless you. This is a very expensive treatment.
Trachoma is debilitating. Patients are robbed of their means of livelihood. they are rendered immobile. Rural communities that do not have access to adequate and clean water are the worst hit. Women and children in particular are the most at risk. The shortage of clean drinking water is visible in rural villages of Gubba Lafto district of this region. As a result, the communities are exposed to trachoma and other communicable diseases. We were 200 households tapping from one water source. A family could draw water from the source only once in 3 days, and the water source was a snail-infested pond that required cleaning time and again. But over a year ago, ORDA built and developed the water source and handed it over to us. Since then, we have been making good use of it by collecting water in 5 minutes' time to meet our drinking and sanitary needs. We have built fence around it and make sure that it stays clean. We used to spend so much time in line to fetch water. We put our children on hold, waiting in line until they get water. We used to scratch the ground for water right from that stream. Today, however, there is none of that sort. We do laundry as needed and drink clean water. Thank you. Trachoma can easily be prevented and treated. However, community awareness on the disease is so low that it is causing so much harm. CBM and ORDA are building water schemes in various rural villages. This would enable communities get potable water that will also help people maintain their personal hygiene and ultimately prevent trachoma or treat it when it surfaces. Residents of Guguftu, one of the Qabales in Dase Zuria, are beneficiaries of these water schemes built by CBM and ORDA. We used to collect water from ponds spread out all over, and that exposed us to various diseases. The water we collect in our clay pots was full of snails and bugs, and we women in particular were suffering from various kinds of ailments. The government then built this for our exclusive use. We, of course, contributed labor. And instead of clay pots, we have started using jerry cans that are clean. We are now healthier.
People and animals were indiscriminately using the water source, making it all the more difficult to get clean water. We even used to trek all the way to Dase in search of water. But once this water scheme was built, we are able to get clean water here and are healthier and living better.
Beyond helping patients reclaim their sight, this project made it possible for people to stand on their own 2 feet and become productive again. Unless stakeholders join the efforts of the government to control the spread of the disease, many people are bound to lose their sight. Trachoma is detrimental to community health and needs to be addressed. And in order for the objectives to be met, we need to look into the future. The intervention requires the creation of linkage between trachoma prevention and related health development initiatives, as well as expanding the area coverage. And that is what the joint CBM and ORDA intervention is trying to achieve.
We've been undertaking various trachoma control activities in Gubba Lafto and Dase Zuria Woredas. We've been identifying and treating trachoma patients, providing potable water, promoting hygiene and sanitation, as well as undertaking capacity building activities. In the last 2 years, 54 clean water schemes were built, benefiting over 10,000 people. and nearly 450 people were given tracheasis surgery.
450 አካባቢ የሚሆኑ የአይን ቆብ ቀዶ ሕክምና ታካሚዎች አገልግሎቱ ተጠቃሚ ሆነዋል.
Meanwhile, one of the most critical components of the intervention is capacity building, an important input to ensure the continuity of the project.
ከነዚህ መካከል ጎላ ያሉት
Nearly 12 nurses underwent a 21-day training in tracheasis surgery that is in tune with WHO standards, and a number of training sessions that had the community at the center were held over the last 2 years.
Substantial progress has been made in the efforts to address trachoma and its causes, and the need for replication has arrived.
በሚቀጥሉት 5 እና 3 ዓመታት ከሁለት ወረዳዎች ወደ 4 ወረዳ ስኬል
In the next 5 to 3 years, we want to scale up the program from 2 to 4 waradas. There are 2 waradas in Wakumra zone, Sakota Zuria and Gazkamla. In Raya Qobo of North Wallo and Dase Zuria in South Wallo, we have planned to execute this project as of January 1st, 2014 at a cost of over $3 million.
ጀምሮ ወደ ተግባር ለመግባት እንቅስቃሴ ላይ እንገኛለን.
አመልድጋ እየሰራን ያለነው በአይን ማዝ ምክንያት የሚመጣውን አይነ ስውርነት እና
We are working with ORDA to prevent and address blindness that comes as a result of trachoma. We had this project that we started in Dase Zoria and Gubalafto running for 2 years. Since this project is effective, we intend to launch similar ones in Dase Zoria as well as in Kobo Waradas. And we don't intend to focus only on trachoma. The disease is linked to poverty. CBM works on disability issues which also involves blindness. ORDA's mission is similar to ours, and we are comfortable with what it does along that line. The outcome could not be seen in 1 or 2 years. That is because there needs to be an attitudinal change in income that comes over a period of time. Also, by expanding educational coverage, people's perceptions would be elevated. We are doing a remarkable job in preventing patients from becoming blind. But although limited to a few number of people, the 2-year intervention was successful, and we have to take that to other locations.